Broadcast. My name is Grace Kuria. Now, President Uhuru Kenyatta has received progress reports on the national rollout of the universal health coverage, including ongoing beneficiary biometric registration exercise, reform process at KEMSA, and launched a national malaria campaign. Let's cross over live to Mombasa County and listen in.
Cost. The package covers several areas, including outpatient and inpatient services, communicable and non-communicable disease management, maternity, dialysis, radiology, minor and major surgery, substance abuse, rehabilitation, emergency services, and cancer treatment, as well as ensuring that we take care of the mental health of our people. These, among others, and we want this provided at the low cost of Kenya shillings 6,000 per household per annum. 4, in line with the clarion call of leaving no one behind, the government will provide health insurance cover to initially 1 million households who are vulnerable and unable to meet even that low-cost premium of 6,000. The identification of these 1 million households by the Ministry of Health, Ministry of Labor and Social Protection, as well as our county governments, is set to begin in a few days across the entire country. 5th, the biometric registration of the identified poor households, which we launched today, is set to ensure that beneficiaries are identified when they seek services at the healthcare facility and at NHIF branches countrywide, and an e-claim system will be used to improve efficiency and to curb fraud and abuse, challenges which we must address as we scale up. Past initiatives to improve healthcare service delivery have not been a success because of these challenges. Ladies and gentlemen, delivering UHC requires close collaboration and synergy within government, both tiers of government. It will also require greater cooperation with the private sector, our development partners, participation of the religious sector, civil society, healthcare practitioners, and support from the people of Kenya at the individual, family, community, and national levels. Indeed, as has been identified in the Building Bridges initiative, Kenyans are eager for improvement in healthcare delivery by both government and private providers. The BBI implementation report proposes fundamental and innovative solutions to the health quagmire that Kenya has faced since the beginning of our nationhood. As a government, leaders and partners in delivering the Kenyan dream, we are called upon to do all that is required of us so that Kenya can indeed be that healthy nation that we seek. The Kenya we want is one in which no Kenyan should leave the country so as to receive the medical care they require. A Kenya that is a world-renowned medical tourism destination, a Kenya whose healthcare bills no longer destroy in a single swoop wealth that has taken decades to create, and a Kenya where every person, regardless of their financial status, will receive the care they need at an institution within the local area, and a Kenya where UHC has become a platform for innovation in developing locally manufactured medicines and equipment. I want to thank, through you, Chair, the county governments. I want to thank our development partners. I want to thank the Ministry of Health, and indeed all other ministry departments and agencies involved in this noble national task for delivering this initiative on time and indeed under budget. In order to secure sustainability of financing for health, I want to urge both levels of government, as has been stated by Governor Oparanya, to ring-fence health sector funds to support the attainment of universal health coverage. I invite all Kenyans and all persons resident in Kenya to register for NHIF and to ensure that they remain up to date with their subscriptions. This will ensure that the fund has the necessary financial depth required to deliver on its very important mandate, in addition to ensuring that in the event of a medical emergency, the fund is able to step in and cover the paid-up member or their beneficiaries. As I conclude my remarks, ladies and gentlemen, I want to make it clear the scheme we are launching today must be a success. In this context, I urge the NHIF to ensure that the precious funds committed to its custody by both subscribers and supporters are utilized prudently with utmost transparency and accountability. Any person who attempts to defraud the NHIF or abuse its processes will be dealt with accordingly as provided for under our laws. Anyway, that's okay. Finally, it is now my humble duty to declare the biometric registration for the Universal Health Coverage Scheme officially launched. Asante. Ladies and gentlemen, I want to just close by just saying, I know we can do this. I know we have the ability to do this if we just work together. I want to urge, especially our members of parliament, don't delay us by unnecessary debates. We all know where we want to go. What we want now is to begin delivering. We want to begin delivering. Our people deserve it and they want it. And we are asking you to partner with us. This is not the time to show prowess in debate. This is the time to deliver so that our people can get this benefit that we all know has turned many, many households in our country into total destitution because of having to cover their medical bills. We have an opportunity now to fix that once and for all. And I am really calling upon each and every one of you to be active partners in this endeavor so that we can achieve this objective for and on behalf of our people. And those charged with the responsibility of looking after these funds, I want to promise you, that if you do not handle these funds with the care and caution that it requires, some of us will go to very extreme lengths to ensure that you shall regret it for the rest of your lives. Let us be clear that we can no longer afford gameplay in this sector. We have a chance. You have heard what Governor Hassan Joho has said here about what he has managed to achieve in just that short space of time, that is saving lives. This is where we want to go. We want to ring fence this money. We want to ensure, just as we have done in education, we want to do the same in health. That the same manner we ring fence our education funds, we should now begin to ring fence our health funds and deliver for our people. Jameni, tufanye hii kazi. Hakuna kitu ingine, na itakuwa furaha sio wako wake, hata kwa macho ya Mwenyezi Mungu atasema kweli hawa wamefanya kazi. Mungu awabariki na walinde. Asanteni sana.
Asante sana. Niombe sote tusimame kwa wimbo wa taifa.
President Uhuru Kenyatta, they're live from the Sarova White Sands in Mombasa, where he just launched the biometric registration for the universal health coverage. He just launched it officially, and the president has talked about various issues, saying that past initiatives have not been a success and that delivering UHC requires close collaboration. The president has also mentioned the BBI report, which proposes solutions to health quagmires that have faced Kenyans over time. And lastly, he has sounded a warning to anyone who may attempt to embezzle funds, specifically directed to the NHIF, saying that he has promised them that if they do not handle these funds well, then some of them will go to extreme lengths to ensure that whoever does that shall regret it. That is part of what the president just said there in Mombasa, where he has officially launched the biometric registration for